Hi, everyone. Thanks for joining us today. As our focus today will be on that ever important topic of sleep. I know I love my sleep time, and it can be so frustrating, especially during menopause journey, to have our sleep frequently disrupted. There's so many factors that can contribute to sleep problems, and I'm really looking forward to hearing what our guest speaker has to share on this topic. My name's Kim Fancher, and I will be your host today. And I'm so grateful to have Dr. Zeke Medina with us today to share his knowledge and expertise on this topic of sleep. Dr. Medina joined us for our podcast series recently, and we are so eager to hear more about some of the practical steps that we can take to support better sleep and overall well being. So now I would like to introduce Dr. Zeke Medina. He is a doctor of pharmacy and certified adult sleep consultant who helps people uncover the root causes of their sleep struggles. After personally experiencing years of insomnia, he became passionate about helping others improve their sleep without depending on medications. Dr. Medina runs his own coaching practice where he blends functional and integrative approaches to sleep, stress, and recovery. Thank you so much, Dr. Medina, for being part of our Positive Health webinar series. I really admire your passion for helping others with their sleep, and I was wondering if you could, first of all, tell us a little bit more about your career and how you got started in this space.
Yeah, absolutely. So I've been a pharmacist for over 10 years now. And along that journey, I struggled with insomnia myself. And I was always that one that was always difficult to fall asleep, difficult to stay asleep. And I really just didn't have a good relationship with sleep until my child was born. And when that was occurring, I knew as a pharmacist I could not be on sleep medications any longer because I was in this hypnotic state that would make me, I don't know, cook and not remember, at night. I would clean and leave all the lights on. And it was just kind of a scary thing once I had my child. And so I took it upon myself to get off of that, but I still couldn't sleep. She had sleep issues and was a very bad sleeper, and we had no idea what we could do. All I could imagine was my dad had sleep issues, I had sleep issues. Now I passed it along to my daughter. But my wife was not going to give up. She signed up for a course, got my daughter sleeping through the night, and I immediately thought this isn't genetics. This isn't hereditary. There's something in there behaviorally that can be fixed. So I decided to be my first client and researched everything that I could find on good sleep hygiene, sleep behavior, mindset, stressors that affect our bodies that don't allow us to sleep. And that's what I came up with is how I teach my clients how to fall asleep and how to respect their bodies and love their bodies. And that's what I've been doing for about, well, my daughter was born in 2016, so, or 15, but we got started in this business in 16. So I've been at it since then, helping mothers, helping athletes, helping, CEOs and directors of people that just, really need to focus on that care aspect. And of course, it's just been growing ever since. So thank you for asking. So I guess today what we're going to talk about, it's we had to think about this. We looked at this and we're like, "Oh man, there's so much info and I won't be able to get through it." It's going to be a two-part series on sleep. And I'm going to give you a lot of helpful things today, but really just kind of taking you on the journey of what normal individuals suffer from and how they suffer and what everything is to do with our sleep, right? Because one thing is we know menopause has a big hindrance on getting not just falling asleep, but good quality sleep. So let me just kind of tell you, kind of heard my story. I've been an insomniac for 20 years. I am in remission, been in remission for over 10 years, and I've been thriving ever since. The reason why I say it that way, because as a pharmacist, we're behind the counter and we dispense a lot of medications. And one thing that I noticed was that I was dispensing a lot of sleeping pills for individuals. And a lot of times you start with one, then another, then another, then another, and now you're combining others to just get some form of sleep. And when you ask these patients, you're going, "Hey, are you able to sleep with this?" That's just my curiosity because I'm an insomniac. And the answer was always the same. No, not really. They just stop working. And as you've seen, I've had insomnia with my father, and then with my daughter had it as a baby, and I was able to cross that out because she's now 10 years old and thriving like no one other, right? So what I started to do is how do I create a practice where I can safely wean people off of sleep medication, right? But also create that coaching for them that is so much more positive than what they might be used to, because a lot of us, we grow up with different habits and we might find ourselves a little bit more self-critical to the things that we try. And if we're not great at it, we might find ourselves giving up. So, as a coach, I have to find a way to find those characteristics in individuals and slowly turn that around so they feel that confidence to start weaning off their sleep medication, trying new things and sticking with it, and then eventually allowing the brain to process new information and be more comfortable and safe. So as you can see, this is my wife, my two kiddos, the inspiration behind what we do as a business. My wife is actually a pediatric sleep coach. She's the one that started the company. She's always on TV, always on social media, always out there advocating for mothers that really are looking for that solution. So if you know anyone, granddaughter, or anyone that's just suffering, they don't have to. We do have options for the whole family. So let me take you just a story that I've had a client. I'm changed her name. Her name was not Sarah, but I'm going to call this story Sarah. She was 42 years old. She was a mid-level executive and a very busy person. Every day she balanced leading a team, being a supportive wife and mother, and then also caring for her aging parents. She was doing it all. But she also felt symptoms of just feeling off, right? So she had irregular and sometimes very heavy periods. She was very restless at night. She would wake up at 2 a.m. and just could not fall back to sleep. She had worsening memory and mental fog at work. She would set something, totally forget about it. And as you can imagine, with that busy schedule, that's easy to do. And then afterwards, just feeling drained. And even after that 8 hour, like she would get good sleep and immediately wake up and just be like, that wasn't enough. So, what I want to do is just kind of dive in because this webinar is about being positive about menopause, right? So let's just kind of break down what are some common symptoms you might feel, not just in menopause, but perimenopause, the time before leading into menopause. And then I want to break this down so you understand what these hormones are doing, when they're doing it, and how, even before menopause, they can still affect your sleep. So you look at mood and cognition, right? You can feel depressed, irritable, mood swings, panic, attacks, even migraine headaches. Hormonally, you got estrogen and progesterone fluctuating, so you can get hot flashes, which lead to night sweats. Weight gain is a big thing. You can have insomnia, like we're about to talk about. And then GI issues, you can have indigestion and bloating and even gas. And then, a lot of women do complain about just aches and pain. And as we know, if when estrogen starts to decrease, it does increase your risk for things like osteoporosis or osteopenia, when you lose bone mass and things like that. So those are a bunch of things as we go through menopause that we are trying to reverse as much as possible because we have to have this longevity throughout life. So we're trying to protect our heart, our brain, our bones, anything that could, you know, push us to, an earlier morbidity or mortality. So when we look at our hormones, this is kind of what's happening. And honestly, men are so boring because it's just a straight line, maybe a little wiggle here and there. But for women, you have a dance that is going on. It is a symphony of hormones at certain times that are causing you to feel different in week 1 and week 2 of your cycle, and even more different on week 3 and 4. So I want to start off with estrogen. I don't know if you can see my mouse, but estrogen is this top pink line that's going to spiral up where that dotted line is. Okay. During week 1, that's typically your menstruation, right? Days 1 through 5, sometimes 7 on some people. And what's happening is your hormones are so low. And this is known as the follicular phase because after your period, this is when estrogen starts to rise. Okay. And it's really just gradually increasing. Progesterone stays low. And what's going on here, and you might notice it in a lot of young women or women that might be perimenopausal, is that this estrogen is very exciting to the body. You might find yourself restless, harder to fall asleep, or potentially waking up in the middle of the night ready to, go and be ready to go throughout your day. You might also know that this might be the time where you maybe work out a little bit heavier because you have that excitation, you have that energy. So from weeks 1 to week 2 until ovulation, estrogen is at its peak. And we love estrogen. This is why estrogen has so many jobs in our body. Okay. It does so much for our brain and our nervous system. I mean, just read a couple of these. A lot of it's scientific, but it helps to maintain memory, prevent Alzheimer's disease. It improves your mood and concentration, as well as things like our reasoning ability. Estrogen is very healthy for our bodies. We might not need the high quantity that we do when we're younger, but through our menopause, you might benefit from just a small amount. Now, cardiovascular, this is important because a lot of women will have an increased risk of heart disease after menopause. So, estrogen helps to maintain the elasticity of the arteries. It decreases the LDL, which we know is bad cholesterol, but most importantly, the LDL that causes that oxidation, that damage onto the arteries. And then it also helps to lower certain things like homocysteine, which is a risk factor for heart disease, and then also many other things. But metabolically, this is where it's really important. I mentioned estrogen helps with energy, right? That's why that follicular phase at days 1 through 14, you might notice a little bit of restlessness in that perimenopause or even before perimenopause at your younger years. And then we also know that it enhances things like magnesium uptake in the body. It helps prevent muscle damage and tooth loss and insulin sensitivity. We want insulin sensitivity, right? Because that's going to help us digest sugars faster, kick them out, store them. So we're not constantly putting sugar as storage as fat in our body. And so there's so many things. And of course, that last bullet point is one that you might notice very well. It regulates your body temperature. So estrogen is such a broad term. But what I like to do is break it down into the estrogen that we see on lab tests, because most physicians will run an estrogen lab test, which tells us total estrogen. This is estrogen that's binding to protein and estrogen that is free, which is the active estrogen. But as a pharmacist that's looking into, okay, not only are we trying to treat the symptoms of menopause, but we also want to make sure that we're not increasing our chances for disease like cancer as well. So here's the story about estrogen. There are three main types of estrogen. You have E1, which is estrone, right? It's primary estrogen after menopause. This is what the fat produces, and it acts as kind of like a reserve source for estrogen. It can convert into E2, but this type of estrogen does stimulate breast and uterine tissue, which is a cancer risk. So you don't want too much E1 in your body. Now, on the other hand, we have E2. This is the main and dominant estrogen in our bodies. This is what the ovaries make. And then after the ovaries, the adrenal glands can make some, the fat can make some as it converts, but it is definitely more potent. It supports the bones, it supports the brain, heart, and your mood. But as well as anything with hormones, you're going to hear this a lot. If there is too much of hormones of any sort, it's going to increase our chances for things like breast and uterine cancer. That's just what hormones are. That's why there has to be a balance when it comes to hormones. And then lastly, is one that you might not ever hear. It's called estriol. It's a weaker estrogen, but it's abundant in pregnancy. That's just one of the things you'll see it. But this gives you a lower risk. It does not stimulate the breast tissue. And this mainly binds, and you'll hear this, and I'll show you a slide, on the beta receptor of estrogen, which is very protective. Okay. So it can help with hot flashes, vaginal dryness, UTIs. And typically, if you've heard of um, bioidentical hormones or compounds, you'll see a lot of physicians, they will kind of put 80% of estriol, which is E3, and 20% estradiol as a combination to have that protective, but also the ability to support the bones, the brain, the heart, and the mood. So it really just combining those, but not giving you as much as you're typically used to with E2 in that perimenopause phase or before perimenopause. So that's just kind of something to keep in mind as how people formulate those. That's just a starting point. You can easily have 90% E3 or 10% E2 or whatever fits you, because everything in hormones is like a fingerprint. It is so customized. And that's why you have to work with a trained physician that is trained in hormones and trained to test these types of estrogens. So let's talk about those receptors that I mentioned. There's two main ones. One's called alpha, one's called beta. On the left, alpha receptors, they stimulate cell growth, okay? Which is good for certain things, right? But too much is not good, right? That when you stimulate things, they start to metastasize and become very much, overly, growing and things like that. On the other side, we have beta receptors, which reduces cell growth. So let's go back to our estrogens. We have E3 right here at the bottom left, which is mainly beta, so it's very protective, less stimulatory. E2 has equal amounts, right? But E1 will strongly favor the alpha, which does more growth, higher cancer risk. Now remember, E1 is what's basically is being produced into the adipose tissue in the fat cells. So that's why a big way to reduce the risk of breast cancer and other cancers is to make sure we're watching that when it comes to how much fat we're gaining per year, because that's where that E1 mainly comes from. Now, on top of this, estrogen, just like anything that gets produced or consumed in your body, has to get out. Okay. So, a lot of times, as practitioners, especially when I'm thinking, okay, who needs detox? It's a popular word. It's almost like a biohacking. It's kind of annoying at this point because people just throw it out because they know it's going to grab attention. Detox is just a normal process that your liver does for everything, right? It has to kick it out because certain toxins can build up and start giving you symptoms of fatigue, of being tired, of insomnia. Matter of fact, there's so many heavy metals out there, mercury, cadmium, arsenic, that can mess with your sleep and your energy levels. Estrogen, when it builds up and our body doesn't kick it out, we are increasing that. So think about those estrogens that are very stimulatory on the breast and things like that. So it's just one thing to keep in mind. Eat your vegetables, your cruciferous vegetables, eat a well-balanced diet. The Mediterranean diet is the key for a lot of these when it comes to detox, because what happens is that your body will start with this little estrogen molecule. It'll go through one phase, and that intermediate phase can be good and bad, right? So it has to go through another phase. And then that final elimination either goes through the bowels or through your urine. And there's supplements that we can do to make sure we are pushing this out of the body so we're not having that abundance of estrogen causing that issue. Because remember, estrogen still very stimulating. It can stimulate your body, stimulate your brain, cause you to have restless sleep if there's too much, or if there's an estrogen dominance. So a lot of people might ask, okay, what can cause an elevation in estrogen, right? So a diet low in grains and fiber. Why is this? Because when our bodies have fiber, and typically you need about 30 to 50 grams of fiber every day, it really helps to bulk up our stool. That's the poop, right? If we're not having a nice fluid stool or bowel movement at least once or three times a day, I know that seems a little excessive, but that's about as much as providers are wanting, 1 to 3 a day. What ends up happening is if your stool is too compact because you're constipated, you are putting toxins in, but then it's flowing through and your body's ripping those toxins back out and reabsorbing them. If your stool is too watery, what ends up happening is that you don't get to put as many toxins into a well-packed stool, and therefore you're reabsorbing or keeping that estrogen circulating back into the bloodstream. So a good amount of estrogen is, eliminated into our stool. So we need fiber, we need grains, we need things to pack that in so we can ship it off and not worry about it. So if we don't have enough, estrogen stays in the body, it stays elevated, and that can lead to some issues down the road. Now, we know about environmental estrogens. They call them xenoestrogens. These are chemicals that will attach themselves very potently onto estrogen receptors in the body, very stimulating, and therefore causing that risk to go up if you're worried about cancer. So think about things like BPA, phthalates. These are chemicals just found in almost anything now, but we have brought so much attention to it that companies are finally saying, okay, fine, we'll get rid of them. But we have to vote this with our dollars. So if you know something has BPA or something like BPA, don't use it, don't buy it, get rid of it. It's just not worth it. Now, I do have a lot of individuals that are on higher doses of estrogen replacement therapy. Make sure you're monitoring it. Foods that can increase your estrogen levels, there's quite a few. Soy is a big one that has estrogen properties. So if you are a big user of soy, I would have it as kind of like a moderate, especially if you are a vegetarian or you have a vegan diet. Now, anytime there's impaired elimination with estrogen, this can be through the liver. So if you are not taking the right nutrients and you don't have a very nutrient dense diet, it might be harder for your body to get rid of estrogen in that first liver phase. And then, of course, any type of constipation or gut disorders that can do, havoc as well. And then, of course, we know people with a lack of exercise, we don't have a lot of movement, a lot of fluidity, and that can slow things down where we hold on to hormones and many other things. So, exercise we'll find is very important to just kind of kick some of these estrogens and other things out of our body. So, how can we lower it? Exercise is one. Eat foods that decrease estrogen level, and we'll go over that in the next slide. um, Improve the health of your GI. We always hear our gut is probably one of the most important things. It's like our second brain. There is this thing in our gut that's called the microbiome, and that has been a very popular word. Now that we've been doing more research, it's gone into every form of, when it comes to your health. Your doctors are starting to talk about it, which is great news. And it's not just taking a probiotic and saying, I'm helping my gut. It's finding the foods and medications that are destroying your gut health and allowing it to flourish again. For example, alcohol is not only bad for your hormones, but it's also an antiseptic that destroys the microbiome into your gut. Along with that, NSAIDs, which are things like ibuprofen and naproxen, can really disrupt the barrier to allow other things to lead into the bloodstream. For example, bacteria, there's bad bacteria into our gut, and they produce byproducts that can leak into our bloodstream and cause an immune response. And therefore, we can have side effects with that. So, really, anything that can help reduce the destruction of our gut can really help out in the long run as we kind of create this nice flourishing microbiome. We've seen phase one and phase two detox. That was that liver slide. And then, of course, if you have estrogen replacement and you're noticing, man, these levels are just continuously high, either lower your dose. And sometimes you can be on synthetic estrogen. Actually, there's a lot that out there that's synthetic, like birth control, that can really give you these types of symptoms where there's really, no need to have it that high. So, and then of course, lose weight if you are overweight, so exercise, eating healthy, by just doing those two can really help to just build more muscle, which is always a huge benefit for anyone that is trying to just, live a healthier life. So I talked about foods, right? How do we lower estrogen if estrogen is too high? And I understand this is a menopause talk, and typically we're worried about estrogen being low, right? But for our people in perimenopause, what ends up happening is that estrogen stays at its normal length, and sometimes it's the progesterone, and we're going to talk about that next, that is taking the dip, and it's causing something called estrogen dominance, which has its own slew of side effects and things like that. So when I'm talking about, okay, how do we lower estrogen and keep that continuously getting out? Cruciferous veggies, right? So you got broccoli, Brussels sprouts, cabbage, kale. I'm not a big kale person, so I won't be advocating for that too much. And is that cauliflower? Yeah, cauliflower. And then you have others, collard greens, rutabagas, turnips, mushrooms. They are very stimulatory in the liver to kick out to kick out estrogens and other hormones. So you'll hear a lot about cruciferous vegetables. And then, of course, seeds and nuts like chia, flax, and sesame are really great to really help that detox and really get the systems going. Now, as with any diet, you do want to add some color, because now you're getting flavonoids and you're getting all these phytonutrients that are coming from different color foods. And just be very cautious with anything that is a dirty dozen type food, right? So if you know about the dirty dozen, perfect. I'll just stop you there. Make sure you eat organic when it's those. If you want to eat organic regardless, totally fine. But there is a food group, there's typically 12 of them, although they do list more if there is, that are being very heavily doused with pesticides and other chemicals, and they've kind of earned the name the Dirty Dozen. So a lot of times kale is on there. So if you get kale, make sure it's organic. Otherwise, you want to take very precautious steps in cleaning it, which can take a long time. All right. So I'm all about ease and just kind of picking things that are really favorable to my schedule. Now, I mentioned progesterone, right? Let's go back to our cycle. So at the very top, we have estrogen, and then kind of creeping up in orange, right? We have progesterone starting to come in. And this is where you might see in perimenopause, where as progesterone starts to climb, it is a more calming hormone. It actually interacts with the GABA receptors in our brain, which is great because we might feel more tired. We might not want to work out as hard, but we might be getting better sleep, falling asleep and staying asleep. However, in perimenopause and other issues when it comes to hormones, the progesterone typically takes a hit. And therefore, when it's not as high as it's supposed to be, the ratio between estrogen and progesterone are knocked off. And oftentimes I see this with very stressful um, individuals, especially if they are operating on multitask. There's not a second for them to relax and rest. Oftentimes the progesterone gets hit because the way our body reacts is in the hierarchy of hormones, cortisol is always going to be produced first. That's our survival hormone. just based on our way of evolving, cortisol has been the savior for a lot of things, so it's very important. And then you just have our thyroid and then our sex hormones, estrogen, progesterone, testosterone. Those are the ones that are always going to take last priority. So if you can imagine, making sure we can cut off this cortisol is going to be very important. But we're back to progesterone. What does that do? Just like estrogen, progesterone does a lot. It has positive effects on sleep. It helps to prevent anxiety, irritability, and mood swings. It also promotes the formation of myelin sheaths. This is down the spinal cord. There's these little insulators that allow you to move and function better. There's also diseases that destroy this that you hear so much of, like multiple sclerosis and things like that. It also lowers your LDL. That's that bad cholesterol. It helps relaxes smooth muscle. So think your heart, your intestines. It also maintains your bladder function. It acts as a diuretic, so it allows you to go to the bathroom, helps build bone. And then when we look at our endocrine, that's our hormones, it really enhances a lot of the thyroid hormone action, as well as what we say Th2. That's like the good part of your immunity. These are T helper cells. And then also induces the conversion of E1, which is that very stimulatory type of estrogen, over into inactive E1S form, right? You don't have to remember that. Just make sure you know that it helps with balancing the estrogen. Now, with that, it helps in ovulation. It maintains pregnancy as we get there, right? We need progesterone to really thicken that cushion for the egg. So obviously, in that much earlier phase, it has a huge ability. And like I said down there, it affects the potentiation of GABA. That's that relaxing feeling that we feel in our brain. So as you can imagine, progesterone has such a big job. So what really can allow this to decrease earlier than we want, such as perimenopause? Now, we've seen some data that shows antidepressants like SSRIs and other older ones can affect the production of progesterone. Also, we know aging, right? Perimenopause, menopause, your hormones are going to take a hit. Typically, progesterone is the sacrificial lamb that takes the hit first. We see it in hypothyroidism. This is that gland that's produced. A lot of individuals see hypothyroid as we get older, whether it's immune related or whether it just starts to burn out and we start to produce less thyroid hormone. We also know that there are certain deficiencies in our body, like a lack of vitamin A, vitamin B6, C, and zinc. These are very helpful in helping us produce our sex hormones. And when there's a deficiency, and this can take months to years to occur, we have less and less progesterone. That's why I'm always an advocate for a very good professional grade um, multivitamin or a professional grade B complex, just to make sure we are giving the right nutrients. Now, a lot of these are other things like increased prolactin production. We can see that with pregnancy, right? Because we're breastfeeding and progesterone is not being produced as much. And that's kind of like a natural form of birth control. But obviously, it's not 100%, right? And then we also know, certain foods can also, especially the real greasy, bad conventionally grown beef is a big one, because there's so many chemicals that those cows are eating from the grain and the wheat that's being harvested with all the chemicals and pesticides and things to really ramp those up for commercial, availability for these animals to eat. So you have to watch out for things that are not organic. And then, of course, stress and high sugar intake. And they're kind of high sugar intake can really cause stress on the body. And I'm going to go over that as well. But when I think of stress, I am thinking that hierarchy of hormones. You have cortisol, your thyroid, and all your sex hormones at the end. If I have so much stress that my cortisol is constantly being outperforming than my sex hormones, then progesterone is typically going to take that hit. So stress can be a very powerful, ally, but also an enemy if it's running rampant. Now, what are some conditions that just speed up menopause, right? Now, we know partial and total hysterectomies are one of them, okay? And I'm going to talk about it in the next slide and what's the data there. Also, chemotherapy and radiation therapy. A lot of individuals that suffer from any type of cancers that need, any type of radiation or chemotherapy, it can really affect our sex hormones. And, there's a symptom called premature ovarian failure. And like I've said, stress, you can really push yourself into an early menopause by just trying to do so much that it just burns you out and your sex hormones cannot be produced at that point. So for anyone that has had surgical menopause occur, I didn't know this, but it's almost like a third of women are having hysterectomies, right, in the US. And it goes from total hysterectomy or partial hysterectomy. But if you get a total hysterectomy, this is the removal of the uterus and the ovaries, and you'll almost always notice your sex hormones drop. That's your estrogen, your progesterone, even your testosterone. And we all need testosterone too. So that's one that I did not go over very, very much, but that is included. And then anyone that's had a partial hysterectomy, that's when they take out the uterus, you keep your ovaries. However, the uterine artery is cut and tied off. So you lose blood flow into the ovaries. And over time, you could notice a decrease in hormones, just kind of speeding up that menopausal feeling. So progesterone levels, they typically take the hit first. Estrogen, it can take a while because when you look at the amounts of estrogen, it's not that much that your body produces, but after years, you'll finally start to feel those much quicker. And then, of course, testosterone levels drop much faster. And testosterone is good for cardio. It's good for not your cardio like running, but it's good for your cardiovascular system as well as, your energy, your mental clarity, and so much more. And one thing you'll notice for women is that it's just a little bit that your body needs. So let's talk about the main topic, disruption in sleep during menopause. Okay. Now, when it comes down to it, what is happening that's causing your sleep to be disrupted? Now, one thing that we are also been talking about, a decrease in estrogen and progesterone, right? This is less energy in that follicular phase from 1 to 14, and then less relaxation in the luteal phase from 14 to 28, right? Now, here's the link when it comes to estrogen. Now, there's this part in our brain called the hypothalamus. It controls our temperature. When there is less estrogen to interact with the hypothalamus in our brain, our bodies find that the temperature regulation thermostat gets a little messed up. What does that mean? Your body starts to feel like it's warmer than it actually is. When your body is warm or hot, just like a fever, you're going to start sweating because sweating is the natural mechanism our body uses in order to cool itself down. But unfortunately, we're not overheated. Our body just thinks it. So we end up getting cold. We get sweaty. It feels disgusting sometimes. And we just have to change and we're just worked up. So, as you can imagine, things like that, you can increase things like cortisol, right? Cortisol is definitely one of those things that is that stress hormone. And when it comes down to it, you find that when it just kind of keeps you more wired. One thing our body does that's really great is it allows cortisol to be produced. And when we actually feel it in the morning, which we have a big jump of cortisol in the morning, you'll notice that your body is not so sensitive to it, but our circadian rhythm changes that sensitivity. So at night, before we wake up, if we get a little burst of cortisol, we are now wired. So that's an important hormone to just kind of keep under control, kind of help us keep our cool, find ways to relax and getting to that relaxed state where we don't put ourselves into that stage of, increased cortisol. Now, we talked about nutritional deficiencies, right? The reason why we can see this is because when estrogen and progesterone decrease, we might notice ourselves a little bit more hungry. And I'll talk a little bit why and the causes of that. But a lot of times, as magnesium lowers, vitamin C, vitamin D, and all those other nutrients that we get from nutrient dense foods, they decrease, which can cause even more issues. And then everyone's heard of restless leg syndrome. I have restless leg syndrome. I notice when I try to stay up a little bit later, I I cannot control it, but my foot just wants to do this little bend thing. But I have a lot of women that are taking certain medications for restless leg syndrome. And a lot of times it's because of the stress. It could be because of a low iron deficiency, and as well as many other things that can occur. But typically, it's stimulated by our central nervous system, and things that we do here in our coaching can really help put your mind at ease and find out when those triggers of restless leg occur. Because a lot of times it's usually at the nighttime when you're not sleeping. During the day, when you're active and you're relaxed and you're doing whatever you're doing, you don't really notice it as much. And so there's something with that. And then lastly, menopause and sleep apnea. You hear this all the time. Women that have obstructive, which is a blockage somewhere along the windpipe of maybe their sinuses, maybe their tonsils, maybe it's some, adipose tissue around the neck. And then sleep apnea can come from certain chronic illnesses like congestive heart failure or just any type of issues going on with taking certain medications. Those can cause certain central sleep apnea, which is your brain triggering to your lungs that, oh, just forgot to breathe, and you just stop breathing. So there's treatments for both, right? But really we're trying to find the root cause and lower the risk of any type of sleep apnea. So those are just some things that we notice when it comes to what is really causing disruption in sleep. Now, some big things that we like to talk about is the behavioral changes. And they typically start in perimenopause, which are years before menopause. So I mentioned a lot of times because as estrogen starts to dip, you lose your energy. And you might feel, okay, maybe I want to nap more. Or maybe you had a horrible night's sleep because of, hot flashes, and you're tired because of that. So you are napping more. And when you find that you're so tired, there's less exercise. And then you find yourself eating later or more. And I'm going to kind of break down why that's the case. And on the second part, we find ourselves tired, but we're not sleeping. What does that mean? That means when you go to bed, you really want to sleep, right? But your brain is still up. It's not really your bedtime. And a lot of times we might just find, okay, well, let me just wait here until I feel sleepy. And what we end up doing is we open a book, a good book. We find ourselves there for 30 minutes, maybe an hour, maybe even longer. Or we find our phones and we start scrolling in bed. We pick up these bad behaviors that are not conducive to relaxation and deactivation of our brains. And instead, we are causing a bad stimulatory effect of what our bed should be doing. And because we're tired, we might find ourselves drinking more caffeine during the day to just kind of get going, which is nothing wrong with just having that, one extra cup. But if it's a constant struggle and you're really building up the tolerance of caffeine, your brain will say, okay, we got a little bit more caffeine, but the waking up features in your brain are being doused with caffeine, which you won't be as tired come bedtime. You'll be more restless. And then lastly, I do see a lot of people, one, two, three, four, five glasses of wine at night just to feel sedated enough so their body falls asleep. So let's talk a little bit about menopause and weight gain and how our diet really takes a hit when these hormones start to fluctuate. So, right here, first one, estrogen. It inhibits those hunger signals, which prevent excessive calorie consumption, right? So, estrogen helps us really, level out what we should be eating. So, when estrogen drops, now we have more intense hunger signals. Now, low progesterone, it can increase that intake in dietary fat, carbohydrates, and simple sugars. These are the things that we see that typically cause us to gain weight faster, because when you have excessive calories and your body has already put them into the liver, the muscles, it doesn't know what else to do. Sometimes it can allow it to excrete through the kidneys, but after that, it puts it in fat if it has so much more. So low progesterone can lead to those types of foods being eaten. And we've known for years, cortisol, when it increases, it facilitates the storage of body fat. It does break down your muscles and it increases insulin resistance. If insulin resistance sounds familiar, it's because we see it in diabetes, where patients are gaining more fat because insulin is a storage hormone. So when you're resistant to it, your body will produce more and therefore start to produce more fat. Now, here's where things kind of go awry, right? So back here in this slide, we have all these less energies and we have hormones to show why, because of the weight gain and the lack of sleep. And then this almost turns into creating that mindset that establishes poor sleep. Now, this is a very complex and it's different for everyone, but it's really quick because a lot of us have grown up high performers or people that like things a certain way and might have certain perfectionist habits. So we start to create new beliefs around sleep. You start to maybe criticize yourself a little bit too much. Maybe you have these high expectations. You're only getting 4 hours of sleep, but you might take something or start something and expect 8.5 to 9 hours of sleep because you've heard it on a podcast. So you have these unattainable goals. And one thing that I see all the time is a lot of the spouses or a lot of the women are comparing their sleep with their spouse. My husband never has problems. He wakes up just fine. And you start to compare. And I tell people, comparison is the thief of joy. So stop comparing. It's you versus you. As long as you are improving, you are doing exactly what you need to be doing to get better and better every single day. So comparison, stop. And then they seem to be blaming everything on sleep. If they make a mistake at work, oh, it's because I didn't sleep. If they wake up groggy, oh, it's because I didn't sleep. So putting these negative thoughts and emotions is only going to trigger your subconscious to automatically think, okay, I'm a bad sleeper. This is not going to work. And therefore make it harder for you to change in the future. And so, like I mentioned, I haven't met too many people that did not have perfectionist tendencies. And they're either great at cooking or great at, cleaning or their jobs or, physical fitness, or their nutrition. And they seem to carry some of those perfectionist tendencies over to sleep. If I do this, then this has to be the cause. And then they get frustrated. So a lot of times we can have all these characteristics, and what does it create? It creates a mindset where you have bedroom dread, you have anxiety around bedtime, or you've created this poor sleep and relaxation stimulus that's associated with your bed or bedroom. So when you look at your clock, you go, "Ah, I really don't want to fight with myself to try to go to bed tonight. Let me just stay up a little bit longer." And our bedrooms should be the exact opposite. So these are things that we need to reset. We need to start from ground zero if this is what you're feeling because it's happened so long, or it's happened even before perimenopause and now it's even worse in menopause. Is we need to reset our thinking. We need to create stimulus that is going to induce relaxation, making us feel safe so we can allow our bodies to sleep. Now, remember, I didn't say to produce a stimulus to sleep. We need to produce relaxation and safety first that allows our body to naturally fall asleep. So, how do we reset? In my network of working with people, I've had broken things down into 4 categories. Top left is relaxation and sleep pressure. How do we get our bodies to basically identify and feel the natural sedative that we actually produce in our bodies to go to sleep. The next one is circadian rhythm. There's so many positive, clinical trials and research that has gone into the circadian rhythm and why it's so important, not just for sleep, but for our longevity and for our health to the future. And then the last two, we have mental stressors and physical stressors. How do we exactly lower these? Because when we have too much stress, it doesn't matter how much sleep pressure we have, it's always going to be second. Okay. Stress is always going to come first. So we have to find those ways. So, how do we deal with sleep pressure? Let's just start with that because I find it a very good starting point. If there's anything to do tonight, how do we increase sleep pressure? First of all, it is a chemical that we build up all throughout the day. It's called adenosine. If you're a science nerd like me, it comes from energy, which is called ATP. And when that breaks down and you have all this adenosine left, it starts to interact with the brain, causing us to feel tired. Kind of a side note, caffeine blocks adenosine, which makes us feel awake. But there's only so much caffeine that can work before too much adenosine is going to take over. So it's what makes us feel drowsy and sleepy. It's our natural sedative. Um, but when it comes to this, we can build more throughout the day with exercise, movement, or sleep deprivation, which I don't recommend. Now, you can decrease it by sleeping or napping or just being very sedentary throughout your day. So, one of the big things I see with a lot of menopausal women is napping too much or napping too close to their bedtime. I usually will say try to keep your wake up time in your nap 6 hours away from your actual bedtime, and that you're going to have to play with. In addition to that, you typically don't want to nap more than 2 hours. I would say 1 hour max if you're having trouble sleeping. And then, of course, we know stress is the enemy of sleep pressure. It doesn't matter how much adenosine you have built up. If your body is stressed and stimulating, there's a big chance that it's going to be very restless when you fall asleep. So you have to do a good job during your day to practice taking breaks. Okay. Now, when I'm cleaning, I just want to get it done. And sometimes that's 2, 3, 4 hours. But you have to find a way to set a timer and go off and just do something very mundane, whether it's a walk, just sitting outside, drinking tea, having a conversation with a friend, just something that takes your mind off of the monotony of just doing a task, especially if you're at work. You have to also practice a wind down routine that is consistent every night or most nights. Remember, you have to be able to tell your brain and give it cues. One of the biggest things for my children was when they were not sleeping, we had to come up with a routine. It involved taking a bath. It called reading a couple books, and then we would go around the bed when they're little babies and say night night, picture frame, night night puppy, night night blankets, night night this, and it just got them into that mode. You obviously don't have to say night night to things, but it might start off with a warm shower. Then it comes up with journaling and then maybe some light stretching and then some deep breathing to really relax you. But overall, you really need an ideal environment to fall asleep. So, what could that mean? Just think about this. Your bedroom has should be like a cave, right? It needs to be nice and cool. And I've set some guidelines here. It has to be dark because little lights can really trigger our bodies to be more suspicious of what those are, especially if they're coming from a window. Noise is very, very tricky because usually between stage 1 and stage 2 of sleep, we will hear certain things. So if it is not consistent or something that is strange, our brain will wake us up. So I use a lot of white noise, a lot of fans, something to drown out any type of random noise. And then, the last two are just more for comfort and relaxation. I like a clutter-free bedroom, but I have a stack of clothes in some random room that I don't want to see in my bedroom. And then I do put comforting scents at times. Lavender's great. Flowers, just in general, if you're not allergic, can be very nice scents to go to bed in. So Some other things that help is to slowly start to create that positive stimulus control with your bedroom. Make it feel safe, make it feel loved, make it feel like something that you're excited to go to and relax. Um, just to allow the brain to just deactivate, right? And understand that this is time to relax. And if you are not relaxed, or if you're not, you're thinking about other things, maybe at that moment, it's not the right time for you to lay down and you need to go do something else. Because that bedroom, you want to start associating it with relaxing to lead to sleep. If you feel like the mind is going, then we need to get out of bed. That's probably one of the biggest things that I would say. If you're finding yourself more than 20 minutes, let's get out of bed. So, with that, it's going to work with your body's natural physiology. We need to naturally cool down close to bedtime. And with that, we are definitely going to find ourselves kind of falling into sleep a little bit faster. Now, I have a lot to say about circadian rhythm. I'm going to save that for part two, where we're going to talk about stressors and treatments and hormones and so many more things. So, one thing I'm going to do is kind of let Kim take over, because thought I would have some time, but there's just so much into this that I want to leave time if we do have some questions. But let me fast forward. Sorry, I can't do that in a much cooler way. But any type of questions before we head out?
I don't think we have any questions that were submitted today. I'll keep looking here if anybody has one. If you want to place it in the chat, and I'll share that with Dr. Medina. But, I just want to thank you so much for this great presentation. I personally learned a lot about, estrogen overall and impacts to our sleep. And I'll tell you the estrogen story and the information on the progesterone were both just so very insightful and helping us understand what really is going on in our bodies throughout these years. And it's amazing with all this going on in our bodies that we get any sleep at all.
Yeah, I'd say women definitely have it much harder than a lot of the men. But it's once you understand it, you become more at peace with it, I feel,
Yeah.
especially at a younger age. And a lot of times it's like that's just it's like none of us have even thought that that's could be an issue. And then when you start treating it, it's just gets even better.
Yes, yes. Well, looking forward to hearing even more in our part two of this. Let's see. I do have someone who put something in the chat. So thorough is what she says, and thank you. Very enlightening all around, and didn't realize how impactful the mindset about it all is, and as well. So kudos to you on everything that you shared with us today.
I appreciate that. And yeah, I think the next webinar, it's going to be all jam-packed with mindset, what affects it,
Hmm.
and what we can start doing to start turning that. And I've discussed a little bit today, but just really scratching the surface. My coaching is literally surrounding the whole mindset and stress and what we can do later on to just kind of keep that. So we identify red flags in insomnia and our health and get to, really handle it face on.
Yes, definitely. Well, if you want to go to the next slide, please.
Sure.
I'll just go ahead and get us wrapped up for this webinar. And I just want to mention that you can view all of our webinars on our YouTube channel. If you go out to YouTube and look for Positive Health, you'll find our page out there with this webinar will be uploaded to it, as well as any previous ones that we had. And so please feel free to go out to YouTube to take a look at all that. And then also in our positivehealth.com/webinar site is where you can register for upcoming webinars. So we will be posting part two here shortly in October sometime to learn even more about what Dr. Medina has to share with us on menopause and sleep. And the next slide, I just want to mention about our podcast series. And here at our positivehealth.com/podcast site, you can view all of our episodes that we have loaded up there, and including one that Dr. Medina did on sleep. So you can hear kind of another little version of his expertise in that podcast. So feel free to go out and take a listen into that. It's available out on Amazon Music and Apple Podcasts and iHeartRadio and Spotify. If those are your favorite channels to go to, just do a search on Positive Health and you should be able to find it. And then just want to mention, if you're not already a member of Positive Health, you can still join in for free for a limited time. Or if you know someone else that could benefit from our program, please pass this information on to them. And you can sign up at positivehealth.com/membership. And with that, big thank you again, Dr. Medina, for everything you shared with us today. Looking forward to hearing even more from you, and really appreciate those of you who are able to join us today. And just like to say night night to everyone who joined, and to our wonderful presenter, Dr. Medina.
Thank you, Kim. Y'all have a great one. Take care.
Have a good day.
Bye.